Hi everyone, welcome back. It's Dr. Somji.
And it's Dr. Solomon here.
Today we're going to be talking about a treatment that we both perform at the clinic quite a bit for acne scarring. It's probably one of the most effective acne scarring treatments. It's Subcision. That's pretty good. So it's probably the most effective thing around for acne scarring if you're appropriate. So we're going to talk about everything Subcision today, hopefully answer all your questions.
So to start with, what is Subcision? I consider Subcision to be the foundation of acne scar treatment, the first stage, essentially the foundational build and the release of the scars. Subcision is a division of scar tissue in the acne scar, in the dermis of the skin, and that division is produced or performed rather by a subcision device. And that can be, for example, a cannula, it can be a needle, but we often use a cannula. So in summary, a subcision is essentially a division of scars using a device.
Yeah, absolutely. I mean, look, at the end of the day, I kind of give people the analogy of like a mattress that's sunken in. And you know, you've got springs in those mattress, and those springs are almost pulling that mattress down from inside. Those are those fibrous bands that you talk about, so in the lower layers of the skin. And they can come up to quite high up as well. So I find when I'm subcising, you go a little bit more superficially and you'll get those bands.
Yeah.
If you remove those bands, then suddenly the other springs around it will just pop it up. So you know, you're basically removing the scar, or you're removing that tethering from underneath the skin. And that's the reason why it's so effective, because it's not like how laser is, because laser was there and was invented for acne scarring to help with subcision. It was going to heat that area to break down those bonds, but sometimes it doesn't heat effectively. Through heat, you can also get other problems, and you need to go very strong with that. But with subcision, you're actually doing what you need to remove the scar.
Yeah. So how do we perform subcision?
Well, it's performed under local anesthetic. So I inject quite a large amount of local anesthetic around that area. So bee sting injection first, and then with a cannula just going around the areas of scarring. The face will feel a little bit swollen at that time, but that's absolutely normal. And then when we're actually performing the subcision, we use a number of different tools. You can use a special needle called a no-core needle, okay? And that comes up a lot more superficially. It can cause quite a bit of bruising, and that's a lot of doctors use that for subcision. We use a lot of blunt subcision in our practice of multiple different sized cannulas. The reason why we prefer that, especially in this sort of cheek area and around over here, is that there's less chance of any nerve injury, which is really, really important, because that's one of the very rare side effects that you can get with subcision. And if someone's very aggressive with very sharp needles, then you can get that. And then for more aggressive cases, where you've got quite a very strong tethering, we use devices that have almost got like this shape. So one of the famous ones is called a Taylor Liberator. So again, it's a cannula, but with two kind of sharpish ends, cutting ends, that you can really direct with subcision. I've seen you do it with ultrasound as well. Yeah. So you see where the tether is, and then you can actually see it break, which is actually pretty cool as well.
Yeah. The analogy I use when I describe it to some patients, I say that it's almost like a sea rig that's tethered to the seabed, and we're just going in and we're basically dividing those tethering cables and allowing that sea rig to just float free, and then we can then go in the later stage.
That's a better analogy than my one.
Yeah. Essentially, that is what I mean by the foundational treatment.
Is.
So you're releasing the scars, or releasing them as much as they can be released in preparation for the collagen building phases that will be performed later on in the scar treatment. So what situations do we perform subcision in?
Well, I think it's about an assessment. So again, you know, when you see an acne scarring patient for the first time, you want to see if it's an atrophic scar, so it's loss of volume, or let's say some people commonly say dense within the skin, and hollowing within the skin. And you can see that most patients, if you're obviously shining a light just above, creating a shadow, and then also feeling with the skin to see if it's tethered. And if you see that tethering and the skin doesn't come across it very nicely, the upper layers don't slide above the lower layers nicely, then that's an indication for subcision. How many treatments do you do for subcision?
So I usually start off planning for 1 to 2 treatments. Often with subcision, you can get away with performing only 1 treatment if you're confident that you have subcised or released all the scars. What often happens is that you go in with the cannula, you go in with devices to subcise, and that triggers an inflammatory process in itself, and that can also retether some of the scars. So later on in the treatments, as acne scarring is a long-drawn process, the treatment of acne scarring is a long-drawn process. So I often go back in, reassess the scars as you described, check if they're tethered, and possibly do a 2nd or 3rd session. But often one case will untether most of the scars. So I usually plan between 1 to 2 sessions.
Yeah, I mean, like personally, I think everyone probably has a couple of sessions. Definitely when you're creating that void, so obviously if something's stuck down like this and then suddenly it comes up, you've got this void in that area. Generally in the first subcision session, that's filled by, actually most of the time, a bruise, which is, bruising is pretty normal. And then that allows those 2 areas to separate for a period of time. Now, if a lot of people that are searching on YouTube and they look at subcision and they look at cannulas, you'll see schematics of doing a little bit of subcision, which looks so easy, if the bronze broke so easily, and then putting filler in for that void.
Yeah.
What are your thoughts on putting filler in that area?
I see filler as almost like a stopgap.
Yeah.
It's certainly not a long-term solution to atrophic scarring. When you do subcise, you're left with a little void there, and you can get this temporary improvement in the scars just by filling that and lifting the scars even more. So it's almost like a supportive base,
Yeah.
But it's certainly not a long-standing permanent treatment for scar, and it does not build collagen. So it is useful and it can give very satisfactory results afterwards, but I always warn the individual, the patient, that the filler that you put in there to fill that void is only temporary. How does a patient prepare for subcision?
So you really just limit kind of exercise for good 72 hours beforehand. No kind of excessive sun exposure. Be a little bit chilled out coming to practice, come on time, don't run to the practice.
And the purpose of that is to reduce swelling.
To reduce swelling, just take it easy, have your schedule cleared for probably about a week or so, I normally say, because the swelling can sometimes last for that period of time. And that's it, really. I mean, there's not so much prep because this is not going to like damage the surface of the skin at all.
We're essentially working just under the skin.
You're working under the, yeah,
Okay.
absolutely.
And are there any risks involved?
Well, I think there's some normal injection-related side effects, so bruising, swelling in the area. These things are pretty normal, some redness within that region.
Yeah.
Definitely, you know, with subcision, if you're into the fat layers, which you shouldn't really be, you can get some contour irregularities because it can take away some of the fat sometimes if you're very aggressive, because it can turn into liposuction. This is the reason why here at our practice we always start with like kind of blunt end subcision and only use kind of cutting subcision cannulas for specific scars to limit the damage. The other thing is that people worry about is a rare chance of nerve injury, and that can be either motor, i.e. with movement of the face, or even sensory as well. And the high risk areas, you know, sit around this area, just in front of the ears in that area, and also lower parts of the face as well. So these are areas you have to be really careful.
Knowing your anatomy, knowing the depth you're in, if you're in a safe plane, the risks are very minimal, and the adverse effects or the temporary adverse effects are limited to bruising and swelling.
Yeah, and you know, doing things under ultrasound sometimes, just checking.
Yeah.
I mean, sometimes just for fun, you know, we look at each other's subcision under ultrasound while we're doing it. I mean, it's pretty cool. You can actually see the tether there, and then you can't see it. But also, you know, the amount of anesthetic you put in is really important because if you put that to method anesthesia, a lot of anesthetic, it just almost blows up that area like a balloon. And it means that all the important structures are a lot deeper down and you're all just operating on that surface. And you've got a wider room for error rather than, you know, that small, minute area.
Okay, so in summary, subcision is a great, simple but very effective first-line treatment for acne scarring. It's releasing the tethering of the scars or the adhesions of the scars. It can be formed by various methods, but really what it boils down to is dividing those scars and preparing these scars for treatment in future stages, mainly to build collagen in the scars.
Yeah, like I mean, and you'll see we do subcision, we inject the anesthetic, we do everything, we subcise, and then you can also do treatments over the top. So doing a CO2 laser, for instance, over the top immediately, it's a great paired treatment that you can get maximal benefits from that downtime that you get as well. Thank you for listening, guys. If you have any specific questions about subcision, just pop it in the comments below. Don't forget to click that link to subscribe and also like this video, because we're always uploading new things and we're always listening to you guys. So anything that you want us to talk about specifically, we will make a video for you.